The international community has been warned it must urgently wake up to the scale of the Ebola epidemic. The virus is spreading at a rate of 5 new cases every hour in Sierra Leone. Almost 3,500 people have so far died, with over 7,000 infected. And experts say it could infect up to 1.5 million people by January next year. Doctors Without Borders say health systems in the worst affected countries, Liberia, Sierra Leone and Guinea, have imploded. You can see here the number of cases and deaths they've had to deal with. Using disease spread patterns and airline traffic data, scientists have predicted that the virus could reach Britain in just under 3 weeks, but say flight restrictions have reduced the risk from 50% to just 15%. France, though, is at slightly higher risk, with a 25% chance of a passenger bringing in the virus by October the 24th.
It would be a different situation if Ebola arrived here, because we would be able to rapidly isolate any case in a hospital and make sure that we had tracked down every contact, so every family contact, every work contact, every social contact of that infected person, and monitor them to make sure that they don't start to suffer symptoms and that no transmission has occurred. Even Nigeria has done really well in isolating it. They had a very difficult situation because they had a passenger arrive who was actually already very ill and was actively spreading. And even though they had secondary cases among the airport workers and then among the medical staff that treated the first case, they managed to keep the total number of cases down to 20.